Hi, I'm Colleen Lindholz, president of Kroger Health. I'm sitting down today with Chief Medical Officer of the American Foundation for Suicide Prevention, Dr. Colleen Moutier, for a conversation around building better support systems for those struggling with mental health. Dr. Moutier, thank you so much for joining us. I'm so excited to have you here today. Can you give us a little bit about your background?
Sure, and thank you so much for having me. So I have been serving as the Chief Medical Officer for the American Foundation for Suicide Prevention for the last 7 years. I'm a psychiatrist by training, and so in my prior life, I was involved in academic medicine, teaching, mentoring students and residents, fellow physicians, and treating a lot of patients and doing research. And it was actually through the experience of my own personal experience with mental health and of course treating many patients, but then it was actually my physician colleagues struggling and ultimately a number of them losing their lives to suicide that really turned my attention fully to suicide prevention now at the national level, which I've been honored to do for the last 7 years.
Yeah, wow, when it's personal, it makes it even better, right? And your background's awesome, so thank you so much for being here today. I really want to talk about how we make our relationships and workplaces safer, to talk about mental health, and how do we support our loved ones and coworkers, and even those like customers that are coming into our stores at Kroger that we know may have some issues, because doctor, this affects so many people. And, personally for me, I have a friend and a colleague that I work with that lost her nephew, Joey, to suicide on August the 29th of 2019. So it's been just over a year that we lost Joey. And what's sad about this is that it was a second loss for this family to suicide. Joey's dad died by suicide in 2006 when Joey was only 2 years old. So, Joey was it was a normal 15-year-old teenager. And he loved animals. He had 4 dogs, horses, a cow, loved Miss Magic, his cow, the most. He enjoyed spending time kayaking, really doing things outside, wakeboarding. It's just like a normal 15-year-old teenager, and then all of a sudden the family is hit with this. And I know Joey's missed by his family, his mom very dearly right now, and so many of his friends. But, can you talk a little bit about, just that overall, what we're dealing with here, and even how it ran in the family?
These issues that we struggle with are human issues. All of us will face challenges, and we all have mental health to manage, whether we have those specific vulnerabilities to depression, anxiety, PTSD, addiction, and which many of us do. It's 1 in 4 Americans who will face a diagnosable and treatable mental health condition over a lifetime. But mental health, like physical health, occurs on a continuum. So we are all dealing with changes in our ways of coping, our sleep, our energy, our fatigue. And I think what's happening in our society is we hadn't known how to talk about these issues as matters of health and as matters of the human experience that should be shared, that can be actually more proactively managed and supported, both in ourselves, but as well in our loved ones. And you mentioned the workplace. That's a fantastic thing that's been happening, that even in a corporate setting, we can create an environment where there's a culture of safety and support so that these issues are issues of health. So just like you would have your physical health addressed and supported by your work environment, the same thing can be true for mental health.
Yeah, and we at Kroger aspire to do that. Inclusion, safety, and those environments where it's open and transparent are what we want here at Kroger. And so, we're reaching for that constantly. And you said, physical health versus mental health. And, I'm a pharmacist by trade, and I've been practicing been a pharmacist for 25 years. And, I remember those patients that I served a long time ago in different chronic disease issues. And, sometimes you can tell when people don't feel good, right? You can tell when things are going on with them. And with mental health issues, sometimes you just really can't tell. When we ask our customers or our patients, hey, how's your medication working? Sometimes they can't express that it is or isn't working. And so, in this kind of instance, what are some of the signs and things that we can look for either as healthcare professionals or as, people that have loved ones that are dealing with depression or different mental health issues or, like thoughts of suicide? What are some of those triggers that we can look for?
As you mentioned, it's harder to tell in part because This is the brain, the mind. These are feelings, thoughts, perceptions. They're
Mhm.
internal experiences by definition. But it's also that we didn't grow up in a society where these things, where we were taught how to share them,
Right.
in ways that are appropriate, where you can lean on trustworthy people and ultimately health professionals as well, where you can learn how to use exercise, fitness, lifestyle, food, as well as mental health treatment, all to benefit your mental health. We're learning now, and we know a lot more about that. But
And to your point there, I don't think people think of it holistically like that, doctor. I mean, what you just said, from exercise to the way you eat to how much sleep you get, I don't think that people think of it as holistically as they probably should.
and right, and but some people are do know, because they've been learning how to do that, and they're seeing the results in their own life, when they manage their sleep in a certain way, when they get a certain even type of
Wow.
exercise, yoga, mindfulness practice, when they eat a certain way and keep
Yes.
alcohol. I mean, it and the thing is, our physical health is not as separate from our mental health as we think either. I mean, there's certain things, a broken bone, yes, but
Right.
the brain is connected to the body. And so much, in if we keep our physical health managed well, that will of course benefit our brain and our mental health. But the same thing is true if we're dealing with hypertension or heart disease, and we also are struggling in some way with our mental health. If we can manage the depression and the anxiety, there is a lot of data to show that you get better outcomes with your physical health condition as well. So it's very holistic and integrated.
Yeah, that can be applied probably across to lots of different chronic diseases, right? That probably if you're not treating them to begin with in multiple ways, it's going to lead to other issues.
Yes, yes, yes. But to get back to your original question of what should we be looking for in our loved ones, in our coworkers, and so I think we have to start with this understanding that people will keep it zipped up to every extent possible because we're just socialized that way, and I think it's kind of innate in us. In a way, it's unfortunate to feel a sense of, like, when we're not feeling our best in terms of our well-being, our
Hmm.
mood, our anxiety, we kind of have this automatic instinct to hide it and to withdraw
Hmm.
and to actually
Hmm.
separate from those around us. So it's kind of a fear-based instinct. So realize that when your radar goes off, that the person in front of you just is showing signs that look a little bit off for them. So I know
Hmm.
that's kind of vague, but your gut will tell you when their speech patterns, if
Yep.
they're your own family members, what their sleep patterns are like, their energy, their activity. When it starts to veer outside their normal range, it means something is shifting. Now, it may not be that they're at risk for suicide, but what is the harm in approaching them in a supportive, caring way to say, I've noticed this and I want to make sure that you're okay. Can we talk, so that I can support you, and really so that I can understand, first of all, like, even just that desire, that interest
Yes.
to know what it is your loved one is going through. Who doesn't want to feel seen and heard? That is
Right.
such a core need we all have.
Yeah, I think those crucial conversations of just letting somebody know that you care, right? I mean, just letting someone that know that you care about them and that you're noticing some things, and just I think sometimes it takes a while for people to sort of get into what is actually going on with them. But yeah, to your point, between loved ones and then actually, customers and maybe coworkers that you don't know as well, of course, as your loved ones. But what are those conversations that you can have to let them just know that you care, and then they can open up and either try to get help obviously within their own individual circle, or be referred to someone like you that could probably help them beyond what they get from their own family.
Yeah, I mean, Colleen, you're so right, and I just want to hit upon something you said, that feeling of support and feeling of even just simple connection, being heard, being cared for, validated. I think if there's one thing that people can take from this, it's that if your friend, loved one, coworker shares something about their internal experiences of depression, despair, anxiety, angst, anything along those lines, thank them for trusting you and sharing something so private and so valuable, and
Mm-hmm.
close to their heart with you. And you have to act in a trustworthy way around that, in terms of protecting it and just really pouring on the support. Because remember, when you're in that mode, your brain will be playing tricks on you. You'll be assuming that you're getting judged,
Mm-hmm.
and
Yep.
we really go there in some very irrational ways. We like to think of ourselves as rational creatures, but not always the case.
Yeah, and Dr. Christine, at Kroger, our purpose is to feed the human spirit. We think that people are hungry for more. They're hungry for uplift, for a smile, for someone to know their name. And so that's why I think, this topic is so important, that people understand that we are truly trying to help people in multiple different ways in life. And I love our purpose, and I always like talking about it, because I think that even doing things like this, we're living our purpose. So
Absolutely.
have you seen, I want to talk a little bit about nationwide, and have you seen nationwide changes in people's mental wellness, just in general, like with the pandemic, pre-pandemic, and then kind of what's going on now in our country? Like, what have you seen from a national standpoint?
The issues of mental health were really in a state of sort of public health crisis in terms of, I mean, it's a few things. In a good, very positive sense, stigma is going down. So people
Mm-hmm.
are much
Mm-hmm.
more willing to have these conversations, and the majority of Americans, it's over 90% in our recent poll, understand and actually say that mental health is as or more important than their physical health. So there's that piece to it.
Oh, yeah.
And yet the need now then is so great. It's not necessarily that mental health conditions, and distress has risen that dramatically, although during the pandemic there is a special situation now going on with that. But it's that, who then knows when to get care, how to get care, who to go to. Insurance coverage is a whole other, difficult piece to this. So we have this sort of growing gap between
Mm-hmm.
need and resources. And I think, our work at AFSP involves policy and advocacy a lot,
Mm-hmm.
because the public will is mounting to really develop and fund these resources that will be culturally appropriate, relevant, effective, and really meet people where they are.
Yeah, I really appreciate your time, and I appreciate what you said. And we have about 11 million people that walk through our stores a day. And we really believe that with, just with what we do, that we can touch people's lives beyond just selling food or prescriptions to them.
Wow, it's great to meet you. Thank you
Yeah,
so much. It was a
so
wonderful
nice.
conversation.
So nice to meet you.